This one, right.
In this one.
Okay, exactly. It is 12 noon, so I'm going to go ahead and start admitting folks now. And I'll do that. Welcome.
Thank you. How you doing?
I'm fine. How are you doing, Miss Laura?
I'm doing well. Blessed.
Good. Good, good. And welcome, Fran. Fran's on mute. We're going to just wait until folks join. We'll just allow a few minutes. We're not sure who all is going to be joining us today, and we're hoping we have a nice group. With that being said, I am actually going, well, I'll wait to start recording. I think I'll just wait. I am going to record, but I think I'll wait until enough folks start joining us. Laura Banks, Miss Angelina, is she's just transferred from the Hay Center over to the Coalition for the Homeless. So
Oh,
congratulations,
welcome.
yes, on her new position. Okay, someone else is joining. I'm just going to be admitting folks.
Mm-hmm.
Admit. And we will just give it a few minutes before we officially get going. Keep track of time here. So we're at 12:02. For those of you who have already joined, you will see here on the screen a QR code, and I'll be mentioning this a few times as we get started, as folks join in. You can go ahead and scan the QR code. I'm also going to place the link in the chat if you are joining via your phone and are unable to scan that. I've just placed that link in the chat so that you can click on it and sign in. We'd love to have you let us know who you are by signing in today. And we will give it, okay, folks are joining. I'm just going to be admitting folks from the waiting room as we get started here. Give it a couple more minutes before we officially start. And then I'll just continue Angelina folks as they come in.
All right.
Welcome.
And you let me know when you want me to.
I will. I will. I'm gonna do an introduction.
Okay.
But I just want to make sure we have enough folks on. So thank you for those who are timely. And I know that I see someone's having volume issues. We want to get all the technical issues addressed, all the technology difficulties. A couple more minutes and then we'll get started officially. Laura, how's it going at the coalition so far?
It's going good. You know, when you first start a new job, just learning the dynamics of the position itself and reading a lot. So
Okay, yeah, good.
it's
Well,
going well.
good. I'm happy to be in touch with you and your partners there.
I know. I was telling Kwana before she said she had contacted you. I was like, "Yeah, I have Tasha from Family Roots." She's like, "What is Family Roots all about?" So I gave her an overview and told her some
Okay,
things that you did for the Hay Center. So she was very
good.
enlightened by that too as well. So I'm glad you did get in contact with her.
Yes, absolutely. And we'll be in contact for sure. Alrighty, guys. I am going to start the recording just because we are into our time here and I want to honor folks' time. I think I may have it. Okay. I'm going to start recording. Recording in progress. Well, welcome today, everybody. Thank you so much for joining us for this mental health one-on-one presentation being provided to you today by Family Roots for Life Incorporated and in partnership with NAMI Greater Houston. We're excited today to provide this information to you all. I am Atasha Kelley-Harris, founding president and CEO of Family Roots for Life Incorporated. We are a fairly new nonprofit organization whose mission is to reunite reconnect, and restore children, youth, and families through the provision of social, emotional, and behavioral health services. We are excited to partner with local community organizations such as NAMI Greater Houston. We have some great things in store, not only today, but even in our future together. And we'll be launching those programs and services shortly through the community. So look out for that. Um, what we're going to do to get started first, you'll see on the screen, here's a QR code. That QR code, if you will scan it, if you're able to do so, will lead you to a page where you can sign in. If you're unable for some reason to scan the QR code, I have placed the link in the chat. I will go ahead and copy that link again and send it again for those who joined afterwards, because I think sometimes when you send it before someone joins, they're not able to see it. So I am sending that once again to you all to sign in, if you will. At the end of today's presentation, there will also be a feedback survey. I will place that QR code on the screen and link in the chat for you to give us some feedback. I would like to also add at this opportunity that there will be time to ask questions at the end. However, Angelina, our presenter today, has welcomed you all to do that throughout her presentation as well, especially if we have a small group. With that being said, I will go ahead now and introduce our presenter for the day, and that is Miss Angelina Hudson.
All right, well, thank you, Tasha. I'm going to try to share my screen now so that everyone can see my PowerPoint.
And I have made you the host to do that.
Thank you. All right, and I'll start from the beginning. All right, so we're going to talk a little bit about Mental Health 101, just how we engage with people who are demonstrating signs and symptoms of mental health disorders. But I added the byline during uncertain times. There's never been a time before so much like now where the mental health of the entire country is impacted by some of the things that we're hearing in the news, not only on yesterday and the day before, but the last couple of weeks. There have been a number of mass shootings at churches, grocery stores, the tragedy in Uvalde. And it just seems as though every time we turn around, there's some more collective trauma that we are experiencing, even in the midst of a pandemic that is resurging in terms of the numbers. And so all of these issues in this era of our lifespan is threatening everyone's mental health. So today, we're going to talk about Mental Health 101, focus on children who are in foster care and young adults coming out of foster care. But I think it's reasonable to speak on the mental health of just everyone, even those like yourselves that are just trying to help and you're looking for more information on how to use best practices. So this particular presentation looks at the source of the things that trigger issues with our mental and emotional well-being. Whether those triggers come from home, school, or the community, there's a great deal of overwhelm caused by stress, and that is one of the triggers of behavioral health problems. We're also going to look on the impact that stress and trauma has on our mental health, and then what can we do about it? Is there anything we can do? And the answer is yes. All is not lost. So I like to start off just by saying who NAMI is. Many people have not heard of NAMI before. I still go into audiences and say, I'm with NAMI Greater Houston. And so just to get us all on the same page, NAMI is an acronym that stands for the National Alliance on Mental Illness. We started in the Houston area in 1988. It started in the country in 1975, and we've been in Houston since 1988. So we're not new. We're not new to the families that we serve that are dealing and facing serious mental health conditions in adults and children. And we also serve to just raise awareness of what mental health conditions are and how can we intervene. But this national alliance is across the country with over 900 affiliates, over 30 affiliates right here in Texas. So what you have here, if you're not from this state, you can find NAMI supports and services across the country. So NAMI was started by two moms that were struggling because they had adult children living with psychosis, and there were very little places to go to find information on how to intervene. Where do you go for help? Where are the community based resources? Who do you talk to? How do you navigate these systems that are hard to find and then hard to communicate with? So, the number one or the flagship program for NAMI Greater Houston is called Family to Family. And this is where our families who have experience walking this journey, they receive training and education and are certified through a national signature program, evidence based, medically reviewed every 2 years. This curriculum is called Family to Family, and our families share this information with other families. So, a part of what we do is psychoeducation, but we also have all of our programs and services are at no cost to the families and individuals we serve. That includes children, that includes young adults, adults, and it includes not only the families impacted, but the entire public. So we have public education awareness initiatives. We are also engaged in advocacy initiatives. Our aim there is to change the laws and legislation that inhibits our population from getting the services they need, especially when they turn into adulthood. What we know is that in the state of Texas, we rank 50th in the country in terms of the dollars per capita that we spend on services for adults living with mental health conditions. So if you have a slim investment in the mental health of adults, and in some cases children living with mental health conditions, then we better pull together and figure out what we can do as a community to serve our loved ones. So again, we do this through psychoeducation, support, advocacy, and awareness, and all of our initiatives are at no cost to those we serve. They cost. It's just that we don't charge the people that we serve. So why is this important? Why are we talking about this today? Well, anyone can be impacted by a mental health condition. It doesn't matter the age, socioeconomic status, background, culture, faith, gender. The demographics do not matter. Mental health conditions, you're not exempt, okay? And mental health conditions can be mild, they can be moderate, and they can be severe. When they're mild or moderate, we tend as a people to explain it away. We just say, oh, it's just my nerves. Everybody knows my nerves are bad, okay? Or we may have periods of higher emotionality, more sorrow, more fear, especially when we're triggered. But when these signs and symptoms of a mental health condition, whether you implode or explode, uh, if they are prolonged more than 3 or 4 weeks, I want to give you three basic indicators. Number one, having trouble going to work or having trouble going to school if it's a child. They'd rather stay home. And sometimes they do. You drop them off in the front door and they walk out the back door. Okay? They just have a really, really hard time engaging with either work or school. For adults, they could go to work, but you can't find them. Or if you can find them, there's something called presenteeism. Absenteeism is when a person calls into work repeatedly, they can't come, they can't come, they can't come. But presenteeism is like a person that's on your team at work, but their productivity has gone flat. They're not working at the level they have been working before. So that's the first big indicator. Not able to go to work, not able to go to school. Second indicator, cannot take care of their daily function. Late everywhere they go, if they go, losing their phone, wallet, uh, keys every single day. Now, I say this and then I couldn't find my keys yesterday, but I'm saying over a prolonged amount of time, more than 4 weeks, right? Coupled with other signs and symptoms, right? So, not able to keep up with their belongings. I remember my oldest daughter. I was so happy we lived 4 minutes from the school because it seems like we just couldn't make it home without her homework being at school and vice versa. We couldn't make it to school without her assignment. or her lunch or something left at home. And honestly, she just called me before this presentation. She left her lunch in my car. And we car share to work. We're neighbors here on our jobs, but some things just don't change. But when you see all of these signs and symptoms kind of showing up, the third one is not able to engage with satisfying relationships. And you know this person, they don't, it's never their fault, it's always someone else's fault. They really have a hard time getting along with people, whether it be at home, at work, or in the community, or at school. They may have more problem in public than they do in private. They may have more problems at home than they do in public, but there is a constant repetition of issues with satisfying relationships. As a matter of fact, here in the Houston Harris County area, there's an uptick in road rage, right? People are being triggered right now. There's a lot of community and collective trauma going on, and people are having issues with their emotional and mental stability. And so these triggers, these stressors in life, you see an overreaction. You see, an uptick in suicides, an uptick in road rage, an uptick in violence. And so it's time for us not only to talk about it, but talk about what we can do about it. And we're going to get to that. Suicide used to be the third leading cause of death among adolescents. That was high. Third leading cause of death. And that was just 10 years ago. Now it's the second leading cause of death. And it's on the rise. Here in the Houston Harris County area, the total number, overall number of suicides have not really gone up between 2021 and 2022. It really went up significantly in 2020 when the pandemic was surging. But now it's leveled off, except the number of minority children, 11 to 17, black and brown communities, Latino and African American communities, that population is rising. For whatever reason, suicide is an option that is on the table among our adolescents at alarming rates. And so, whatever protective factors we had, whether it was sports or school or church, whatever it was, grandma, whatever those protective factors were, now it's a struggle. And those factors are either not present or they're not serving our youth in the way they once did. So, we need to have that discussion. And here's the truth, and this is why I'm here today. Over 90% of people who are accurately identified, diagnosed, and treated live the life they want. There is no other medical condition where recovery has such a high effective rate. The issue is we have to do what we can to prevent these issues from being as severe in our community, the mental health conditions, and we have to have the right interventions. We have to go to the right therapist or the right doctor or the right type of provider that's going to complement the way we operate, how our children accept that intervention. And so there's some education that needs to happen in our community. So what makes NAMI different? What makes us different is that we complement clinical intervention. There is no one with NAMI who is a clinician, and we talk about it. If we are a clinician, we keep it to ourselves. Because what makes us a leader in this community is our program leader, is that we have lived experience. So we take our experiences, we couple it with research-based, evidence-based curriculum and models of intervention, and we walk the journey with the family or the individual who's impacted. We do this among teenagers and adolescents. We do this among adults. We do this among seniors. So if you want to be a part of that makes this better, that helps us identify the people represented in these communities, we're asking you to join forces. We're asking you to join the team and become certified and trained and help our families serve additional families. So here's our basic belief system. These are our principles. First of all, I didn't know I was the expert. 21 years ago, I sat in my first NAMI class. I didn't know about NAMI. It was a school teacher that told me about NAMI. He and his wife were teachers, not only in the school district, but they were teachers, volunteer teachers for the NAMI programs. I attended that class, and to my surprise, I sat in that class with 22 other parents. And even though we didn't have the same age children, we didn't have the same diagnosis. I didn't even have, my child didn't even have a diagnosis yet, but we all were dealing with common universal issues. We all had similar problems. We had similar fears. We had trouble com- comprehending and coping, right? And through the pages of that curriculum and the two star teachers that sat at the front of the room who had already walked the journey we were just beginning, we were confident watching them that maybe we could do it. Listen, confident that maybe we could do it. And we could do it with dignity and respect. And that is exactly what happened. So that's what makes peers, peer led programming. That's why the first thing you may not be the expert in pharmacology, you may not be the expert as a diagnostician of psychiatric conditions, but you are the expert in your own condition. You know best what is happening behind closed doors, and you also know best what practices you can buy into and what treatments and interventions are going to work best for you based on your value system and what you believe. The other thing we tell families is that you don't need to know everything all at once. One of the things that came to my surprise, this is not everybody's story, but it's mine. The diagnosis doesn't matter to me. What matters to me is what are we trying, what negative new behavior do we want to do we want to kind of manage or get over? And then what positive symptoms would we like to bring into the fold? So it's all about managing. It's managing behaviors. If I haven't said it already, I'll say it now. There is only one indicator that there's a mental health condition on board. Mental health conditions impact the way a person thinks, their thoughts and perceptions. It impacts the way a person feels, their emotions. It impacts a way a person behaves. Because your thoughts drive your feelings drive your behavior. When all three of those things are not quite right, when they're off, when they're not reading the world the right way, when your thought processes are creating behaviors that are not quite, you know, they're just not based on fact, then guess what happens? Our whole physical being is impacted. So those are the four things you're looking for. Is a person off in their thinking? Are they off in your estimation, right? Are they off in how they feel? Are they showing the most inappropriate emotional response? Are they off in their behavior? And you see that first. And what is happening to their overall well-being? Are they sleeping? Are they eating? Are they dressing the way they used to dress? I normally, before I came up with, not came up with, before I learned through the National Council on Behavioral Health, those top three indicators were the live, laugh, love, ability to go to work, take care of your own person, and enjoy satisfying relationships. I used to tell families, look for a remarkable change in behavior. The way a person used to be, they're not like that anymore. And you know it when you live with them. But you don't need to know everything up front. Because this is a journey, these issues can be chronic. You have to take on the information as you are able to comprehend and make adjustments little by little. And you can't know what no one ever told you. One of the things I find in our classes is that people would say, man, I wish I had known this 4 years ago. I wish somebody had told me that all I had to do was call the precinct 1 and get an involuntary commitment, and I could have got a diagnosis. And no, you don't know what no one's told you. So shame, blame, and guilt, we throw that out the window. There's no stigma, there's no shame, and there's no blaming in our class. Mental health conditions are no one's fault. They're biological, medical, neurological disorders. And mental health characteristics, I brought this up before, are universal. So what we provide is current information, a variety of solutions based on our experiences, because no one thing is going to work. There's no magic wand. There's no pill that's going to take it all away. It's just not. It's a multimodal, multifaceted approach that you're going to have, not only to help that person with their stability, but to hold on to yours. You need a lot of empathy and understanding at the time, because let me tell you, your biological family, sometimes they don't want to hear. Even spouses tend to not walk into NAMI on the exact same page, right? So having a NAMI family who's been there and done that, having other people that you surround yourself with who are not critical, who are not judgmental, who are providing space and empathy is very helpful. And then, of course, we share information and resources that is local. So I already brought this up, that mental health conditions impact the way a person thinks, feels, and acts. But the thing that I hadn't mentioned is how common it is. Okay, 1 in 5 adults, 1 in 5 children in any given year will demonstrate something that is diagnosable. Doesn't mean it's diagnosed, just means it's diagnosable. And you probably have many that you could think of that may be diagnosable. But here's the thing, mental health conditions are real. And unfortunately, some people believe they're not. And age doesn't matter. A child can have a mental health condition, and it's treatable. And if there was any other illness, if there was something wrong with they broke their arm, or if they had, seizures, you'd run to the doctor, you demand intervention. But sometimes, because it's behavior, and we get embarrassed when our children have peculiarities, or we get angry with them when they do things that we wish they would not do. Sometimes we have to stop and really evaluate. Do they have any control over that? I remember, I have 3 children, okay? And the first one that brought me to NAMI is now diagnosed with autism. The other 2, a couple of years after the first one, while they were in elementary school, were identified by the school, not me, right? I have one child that's diagnosed at that time with ADHD and auditory processing disorder. And it really took me by surprise. I did not know, because she was well behaved and was able to respond. Everything was yes. If you've ever met someone whose English is not their first language and they just say yes, that was her. She always smiled and said yes. But at 6 years old, we found out she could not hear, and there was nothing wrong with her hearing. It was the processing in her brain. She did not hear what other people heard. And if you don't know that by age 6, it could really hurt a child's ability to learn how to read, how to write, and do well in school. And so we caught her in time. But again, I had to trust, and I did not. My initial risk, we're going to get into trauma in just a minute, but when you are facing a mental health condition, it is a trauma to the person who's diagnosed, although it wasn't really a trauma to her. It kind of enlightened her. She was happy to find out what she had because she was so young. But most people are diagnosed somewhere between, 17, 18, 19, 20, just the time that they think that they're done and they're ready to start their own independent life, is as if the rug was pulled from under their feet. And so there's something to know. Education is really critical, not only for the family members who are trying to love and support this individual, but for the individual themselves. And we're going to get to that in just a minute. But it's no one's fault. It's no one's fault. I have a third child, the last one, and he was diagnosed with ADHD and ODD. So yes, we saw the problem, but we had no idea it was related to his neurology. It wasn't until he was in the 7th grade. So imagine all the field trips he needed to go, all of the hot water he was in with his dad. I cannot begin to tell you the thunder and lightning that was going on in the house, because, we thought it was just all behavior. But in the 7th grade, he demonstrated a very severe visual processing disorder. It almost looked like dyslexia, but to the reading specialist, not to us. But when they tested him, they found out that when he was looking at white paper underneath fluorescent lights, the letters danced off the page, they made rivers, and they made waterfalls. And this was a very, very intelligent young man who had been making hundreds, straight hundreds in school, straight A's. So I asked him, why did you not tell us that the letters were moving off the page? And he said, I thought something was wrong with the paper. And I said, but you're so smart. You know better. You know it couldn't have been all the books and all the papers. And he said, but it doesn't happen all the time. It only happened according to the brightness of the white paper. So paper has a brilliance number, right? All white is not white. So the higher the brilliance of the whiteness of the paper, plus he had to be directly under a fluorescent light. So he was getting in trouble for wearing his hood over his head. He was getting in trouble for being under his desk. He was in trouble for putting his head down, and he would make a shadow with his arm. He was always in trouble. And he would lean back in his seat and tilt it on its back legs, and that was all about getting out of the light. We had no idea. But here's the fact. He didn't know. We didn't know, and he didn't know. And that comes under the definition of ADHD. It's a processing disorder. So, and why did he make straight hundreds? He memorized everything. He has auditory giftedness. He can remember anything you tell him. He has a huge vocabulary, but he can't spell anything because he couldn't see it. And so once we got him diagnosed, once we got him treated, we understood everything. But poor kid, he had a horrible time. He had a horrible time. So 1 in 5 adults, 1 in 5 children. Now it's 1 in 3. With all the stuff we've had going on with the pandemic, it's 1 in 3. Nearly 60% of adults and 50% of youth, guess what? They don't even get treated. Why? Because nobody wants to be diagnosed with a mental health condition. Nobody wants that label. Ooh, don't label my children. Them people, they're not going to label my children. Okay. But there's misinformation out there. The label, the diagnosis, that's how you access services. That's how you get treatment. That's how you get an FBA and a BIP. So the Yahoo who was in trouble all the time, thank God for NAMIGH. Because I learned that when you have a behavioral health condition, and I learned this with a child with autism, you get a functional behavior assessment and you get a behavior intervention plan, and that has to be approved by you, the art committee, so the parent has a voice in how discipline is rendered in a school environment. Without that, without an FBA and a BIP, which is a legal document, then that child with a behavioral health condition is treated and punished and dealt with like every other typical developing child, even though they have a diagnosis that could be creating a disability in that area. Understand what I'm saying? You can have a disability that hampers or hinders your ability to control your impulsivity. That's called a manifestation of the disability. And if it is not diagnosed and it is not documented, then there's only one way schools deal with behavior, right? And that's through that disciplinary review board. And so then that's where our kids, sometimes their behaviors, if they're not understood, if the function of the behavior is not identified and replaced, okay? The other thing that happens is, and I'll share this other, 38% of children who have a diagnosis that's not treated or identified will start seeking other methods to self-medicate, right? So that's the first gateway to the drug scene, because they know something is different, but they're not sure what. There's a lot of anxiety, depression, maybe some OCD features, but you don't know it. All you know is that young man has to behave, or that young woman, she needs to watch her mouth. But you don't know what the triggers are or the function of the behavior. So eventually the child and then adult starts to self-medicate. 40% of youth are in foster care programs. 1 in 11 children across this country live in Texas. So 40% of 1 in 11, that's a lot of children in Texas. And up to 80% are going to experience some significant impact on their mental well being in their lifetime. It comes with the territory. You know, when the news broke out in Uvalde about the young man who had just done this heinous thing at the Ross Elementary School, my mind immediately went to all those children that are being separated from their parents at the border. I'm not making a political stand. This is not politics. But there are children across our country that have been placed in retention centers, and they've been separated from their parents at very young ages. All of this impacts the brain. The brain is a social organ. We are wired to connect specifically with our first attachment. That is, whoever that initial caregiver is. When there's been an interruption or there's been a negative attachment to that first caregiver, it impacts the brain. By 4 months of gestation, guess what we have fully formed in our brain? Fully formed. We have the amygdala. The amygdala is the part of the control that dictates our emotion, whether we cry, whether we laugh. Amygdala is all about emotion, right? You got that in vitro. But you know it's not developed, not even a little bit at birth? Your prefrontal cortex. So you're born with this ability to experience fear, anxiety, anger, and no ability to control it. None. How do we learn that? By borrowing, if you will, the prefrontal cortex of whoever that first attachment is. That first person. And that attachment is either going to be a secure attachment or it's going to be an insecure attachment. And if you lose that attachment within the first 6 years, first 10 years of life, guess what it does to the brain? It creates something else, and it's not healthy. Not if it's not done with another secure attachment. That's a whole nother training. I just threw that. I don't know why that came up for me, but
that's great, Angelina. Thank you so much for bringing that up. We do want to bring it around to foster
about
care.
This population, right?
Yeah, absolutely.
So
thank you.
All is not lost. If a person has their first attachment style, which is not secure, or if it's broken, it's not lost. You can recover. Like, if you think about it like this, who in your life really changed the trajectory? Any adult, this is like an activity you can do on your own. I don't have to convince you, you can convince yourself. Who in your life has made a positive change or difference in your life? For some people, it's a teacher, a pastor, a neighbor, a Sunday school teacher, the crosswalk guard. It'll be someone in your life that, man, that person really impressed upon me, and now I was going this way, now I'm going this way, right? Well, how old were you? How old were you? Was it someone you met when you were 6, 15? Was it your college professor? Was it your principal on your campus, your teacher, now that, that's your mentor? No matter what the age, you can still create a new attachment. And it be a safe and secure one. So, going back to that first slide where I talked about the trigger to most mental health conditions are related to your experience in the world, right? In life, you're going to have stress. So what does stress have to do with mental health? Well, I'm going to tell you. This is some research that I picked up through a group called Field-Led Schools. And if you have a child, any child, but especially a child in foster care, right, where that whole attachment story has been interrupted, stress from any traumatic experience, it can impact a child's psychological and physical health and their ability to connect with the world from that point forward. Why is that important? That is important because it impacts the way they learn. The most optimum time that a brain can learn It's called neuroplasticity. It's a whole thing, okay? But the optimum time that a brain can actually receive and retain information is when it's calm, when it's not stressed. I don't know what we're going to do next year. I don't know how we're going to get kids to not be stressed out about going to school next year. Because if the brain is in the flight, or freeze mode, guess what? It's going to be at the heightened state of stress. They're going to have problems with problem solving. They're going to have problems taking on new information. They're going to have trouble exploring, raising their hand to ask questions. All of that, all of those different techniques in learning is when the brain is at its most calm, not aroused state of mind, or state, period. So we have work to do. We have work to do. The adults, I did a presentation for Blue Cross Blue Shield, and we were talking about saving our children. And I'm going to tell you what I told them, and that is, you are not going to save the children without first saving the adults. It's just like that airline stewardess that says, if something happens to the plane, I'm like, what you talking about if something happens? I'm on the plane. Anyway, if something happens on the plane, they say, put your mask on before you give it to the child. You know why? Because if you're not healthy, the baby not going to be healthy. And I use the word baby loosely because the more white hair I get, the more I refer to 20-year-olds as baby, 25-year-old. So, but people that you are invested in, people that you are overseeing their growth and development at any age, if you're not healthy, they're not healthy. So students across the country have experienced this prolonged state of toxic stress that I'm talking about. See, there's two kinds of stress. I don't know if I have that slide. No, I don't think I do. There's individual stress, right? Like poverty, transition. And when I say transition, I do mean like in and out of foster care, right? Because sometimes people can be in foster homes and several different ones. They can be exposed to several different things that they've seen and experienced, right? Or even worse, they could have not been successfully placed and just been in limbo, right? In some sort of youth retention center, not feeling like they're at home for a while. So they're not attached to anything or anyone, or they could be homeless. There's that. So these prolonged states of toxic stress have been happening to those in foster care and those not in foster care. It's been all of us. But it's worse though when you were already dealing with those issues before the collective trauma. So yes, we've had the news, the pandemic, the war in Ukraine, the freeze that you don't know. We had a freeze in Houston, what, 2 years ago now? Some people have not recovered from that. So you already have some underlying issues such as instability in your housing, not being included in a family, moving from one foster unit to another, and then you add the collective traumas on that. I mean, we're resilient, but this is impacting the brain. It drives down morale, and it drives it down in our school environments. And the reason I keep bringing up schools is because our kids spend so much time there. Spend a lot of time. 40% of their time is in school. And I had to add mass shootings to this slide. And the most frequent emotions that you're going to see demonstrated through a child or young adult, now I have to say adults too, is fear, anxiety, worry, overwhelm, and sadness. And if this goes on 4 weeks or longer, if the child or the young adult begins to ruminate, and this is all they're talking about, and they're making their life decisions based on those thoughts, remember, it's your thoughts, then your emotions, and your behaviors. If the behaviors are now being driven from the emotions and the thoughts, that are founded in anxiety, fear, worry, and overwhelm, then they're going to need professional help to get out of it. Not going to be able to do that alone. And here's our next problem. Our next problem is there's such an overburden on that system. What used to be a 2 to 6 month wait to see a therapist in the greater Houston area is now 6 months to a year. You think I believe you there, but I'm not. I got an answer for you. So there's a lot of anguish and isolation. So to the point that teachers and students don't want to come back to school. And this was a study done in February 2022. The mass shooting was in Uvalde just happened. Those numbers have probably changed for the worse. The mental health of students and educators is at risk. And if we want to avoid further school disruptions, teacher burnout, teacher turnover, dropout, suicidal ideation, then we're going to have to change what we do. We're going to have to change. I was interviewed about gun control. You know, do I think it's mental illness that's the problem with mass shootings, or is it gun control? And I think there's work to do on both of those areas and then some. I think there's work to do in terms of why isn't mental and emotional health a part of health education? They taught me how to brush my teeth in the second grade, but they didn't tell me how to, you know, modulate and regulate my own emotional well-being. You can start with children as early as 3 years old. It's a thing. Let's talk about it. But it's still not a part of the curriculum. Gun control, I think I'll just stay away from that topic if you don't mind. But there's work to do there. There's work to do. But here's where my mind went. Let me tell you where I went. The grandmother of the young man in Uvalde, she was really the last lifeline. Yeah. Who was there for her? Who was there? Who could she call? Ma'am, is he a threat to himself or a harm to others? Well, he will be, but he's not right now. Well, call us back. I'm not saying that happened. I'm just saying we have a system that will respond to a crisis situation, but the crisis situation has to be there. What do we do for our families that have emerging signs and symptoms? Jennifer won't eat. She hasn't eaten in a week. Well, ma'am, is she a threat to herself or others? And then, even once you do get them diagnosed and treated, families are then called upon to be the case managers, the medicine administrators, the nurses, the mental health professional, and the group home caretaker for people living with serious conditions with no mental health training. I didn't get a PhD in anything related to mental health, or a master's or a bachelor's, but I had to run that house. And so that's what we're asking you to do. We either ask you to be a part of the foster care program and know and learn all these mental health tips and interventions, right? Or provide it to the people who need it. And we certainly want you to answer the phone and be a help to someone who's in a moderate crisis, not an extreme crisis, because we don't want it to escalate. My slide's doing something funny. So 12% of parents, now this was an older study because we did studies during the pandemic, right? Said, okay, you know what? My baby not going back to that school. What about now, after the last 2 weeks? So the problem doesn't just impact the bottom line, because, you know, there was another slide in there that was talking about the impact of the school district's finances. See, the state provides finances to schools based on what? Population and attendance. Why do you think it's a law called truancy that you can't break? Because the entire ecosystem of our academic structure is based on those students being in that school. But the problem doesn't just impact our bottom line. It impacts the students. So let's go back to prolonged stress, toxicity, and stress so that you'll know what I'm saying. When we've been exposed to the stress over time, and there's no way back to the baseline, and this is kids or adults, then we are running like we are in the military on the front lines, right? There's no calm state. We're hyperactive, hyper vigilant, or we're feeling run down and lethargic because we've been at that high activated rate for too long. We're running slow and low, and it makes us more hair trigger happy. So the problem with this is the more stress we stuff in, the less we can take, and the easier it becomes for us to snap. And that's where that road rage stuff is coming from. And then once you've experienced that prolonged high stress state over time, it impacts your behavior, it impacts your learning, it impacts your physical and your mental health. You start having somatic symptoms. You're like, what's this? Okay. So unrelieved activation of the it's called the limbic system, or the body stress management system. It gets stressed out whenever it feels threatened. And I'm telling you, our society is feeling threatened right now. So this is called trauma. The brain, it doesn't matter what you call it, really. The brain's gonna see it as trauma. So when you've had this prolonged stress over time, so why am I sharing this with you? Because trauma is not just surviving an earthquake. Trauma is not just being in a car accident. Trauma is not running out of a burning building. Trauma is what you and I have been experiencing over the last year or two. When it's prolonged stress, right? You start to have a long-term memory of what it is to feel unsafe, to feel powerless. George, what was his name?
George Floyd?
Yeah, yeah.
Mm-hmm.
Yeah.
Mm-hmm.
I felt helpless.
Yeah.
When I watched that 8.9, what is it? 8 minutes and 9 seconds?
8 minutes, yeah. Too long.
I felt powerless. Unable to cope with, you don't know, and we're not numb to it. We're just feeling powerless. Oh, here it is. I did have my slide about individual trauma would include things like hunger, abuse, neglect, microaggressions, accidents, household dysfunction, loss of a parent. These are natural life household dysfunction and abuse and neglect are not. But when you add collective trauma experiences, and that's what's happening to our foster kids, when you add this collective trauma on top of their individual trauma, it can just be too much. It can just be too much. So how do we fix it? Do I see someone's hand raised?
Yes, you see mine, Angela. It's only just to give you a time check. We are at 6 till the hour, and we do have a few questions we'd like to get asked if possible.
Okay, so I'm just going to give you the answer, and then we'll run to the questions. The way to combat all of this is with facts. You got to have the information. You got to know where the resources are. I have a one-pager with community-based resources that I'm going to send to Natasha to send out to everyone who's here. Our education classes will share with you at no charge the curriculum. We mail it to you. We email it to you for free. The warning signs, how to avoid being overwhelmed by the rock slide. That means you had one problem, but now you got 5 because you didn't fix it. We help you avoid the rock slide. We help you deal with the feelings of isolation, grief, fear. We have people that will come talk to you about the exact same diagnosis you may be facing or dealing with and how they recovered from it. We'll come and do presentations, host support groups for your entity with peers. If you don't have one in your area, we'll train you, right? We build capacity. This is our approach, the biopsychosocial approach. I'm going to save you from my long story, but get a diagnosis, understand how it impacts you, and find your people. Find the people that are going to love and support you. We share how to navigate systems, how to find an accurate diagnosis. It's not always that easy. what treatments. I'm telling you, this education is solid, and it's medically reviewed every 2 years, so it's the most up to date information. Um, how to seek treatment, what are the questions you want to ask. And I was always going to go through these slides quickly. This is a part of a larger curriculum. All right. We talk about all of the most popular therapeutic intervention techniques, those that are not so uh, clinical, right? Some holistic options. We talk about who are the providers, who do you go see. We do a whole week on just the medication because what we say in our community is, I'm not taking that, but you don't really know how it works. So we have a whole week just on that. What do you do when someone is suicidal? Where do you go? How do you talk to them? What are the warning signs of how do you know it's you, right? How do you know that you need to seek help? How do you handle a crisis situation? How do you prepare for a crisis situation? How do you set limits so that person doesn't run all over you and make you run out your own house? And how do you let stuff go that you can't change? And we do this all under the auspices of being your peer. We're not a clinician. We talk about self care. And I'm going to stop right there because the last 4 slides are the techniques of what you can do at home. And I can just put that in a flyer and send that with the community based resources.
Thank you so much, Angelina.
Yes.
What I'm going to do is share some of the questions that were submitted through the chat. I'm going to ask everyone who's on, please do not leave us if you can hang on just a couple of minutes after the hour, just because we do want to get some more feedback. But let me go ahead and ask these questions that have been submitted and see if we can get those answered here. So the first one, because at Family Roots, our focus is on those children, youth, and families, primarily those who are impacted by the foster care system, as you mentioned here and there throughout your presentation, and even specifically on transition age youth and young adults. There was a question that says transition age youth are particularly vulnerable group and have one of the highest rates of mental health problems. How is NAMI helping this particular group, and how can others help us help this group of young people?
The primary thing we're doing with transition age youth is we are training transition age youth program leader so that they can share their stories of hope and recovery, and they can teach the classes. And we are recruiting specifically on college campuses through the counseling centers and the wellness centers.
Absolutely. Thank you for that. Another question is, there is so much tragedy going on in the world, as you referenced in your presentation. We know that people are sad, people are angry, people are upset for many different reasons because of all that's going on. How should we take care of our own mental health and the well-being of our children and family members? What are your thoughts there?
That is going to be on that sheet that I send you, but it includes talking about it. Don't sugarcoat it. Be very honest and real. Turn off the TV. Get out the house. Find other rituals and things you can do as a family that is not include feeding on all the information. We want to be informed, but we have to protect our mental health and remind your children or transition age youth. I say your Tay youth because I get tongue tied. That there are still more good people in the world than not. That evil is among us, but at the end of the day, we only get what we get on the TV, and there's so much more out there that we don't hear about.
You're exactly right, and we need to turn off the TV, social media, the internet, all the ways we're receiving that negative information constantly.
But do talk about it and let them air it out.
Absolutely. Another question is, because there's so much language around people with mental illness and violence, how can we address the stigma and negativity?
The research states that people with serious mental illness are more often the victim of violent crime, not the assailant. These are people that are clearly dealing with dissociative disorders, psychopathic disorders, and that whole group are usually people who've been traumatized. These are not people who just have organic, hereditary based mental health conditions. There is something that is triggered. But again, this is the minority of the small percentage. It's not the majority, right? And right now, we don't know that young man's motivation in Uvalde. There's
Mm-hmm.
also something called hate
Mm-hmm.
that is taught. So
Yeah,
we don't, so we have to be careful not to simply label all heinous criminals or their actions as mental illness.
mm-hmm. Mm-hmm. Thank you for sharing that. Couple more questions here, and then we can come to a close. We'll just get one of these questions in. And you mentioned some of it related to trauma that children in foster care have experienced, or abuse and neglect, and the multiple transitions. But this question says, how, as caregivers of children from hard places, and when we say hard places, those children who were abused, neglected, traumatized, how important is it for caregivers or parents to be aware of the mental health risk factors and getting children the help they need?
Critical. 80%, it's up to 80% will have a mental health condition in any given year of the 40% of all youth that are in foster care. So you have to know what the signs and symptoms are. But I think we have to be careful too not to overdiagnose. So it's a fine line. Even when you have a child who's diagnosed, it's hard to say if that behavior is really the mental health problem or just them, just the personality. So I think there's two sides to this that you have to get educated on. One, yes, just take one of NAMI's curriculum classes and learn, right? But the other is also learn about attachment and how it plays a role in a child's growth, development, and behavior. And there's an
Absolutely.
organization for that on my list that I'll send you.
Okay. Wonderful. What I'm doing is in the chat, you all will see, you see here on the screen a QR code. If you would please scan that QR code, as I mentioned at the beginning, and provide your feedback to us, or you can actually click on the link in the chat if you're unable to scan to give us some feedback as well. We want to thank our presenter today, Angelina Hudson from NAMI Greater Houston, and all of her expertise that she shared with us today. Lots of wonderful information. As we saw here, we had to go through really quickly because there's just so much more to be shared. And what we will do is have Angelina back to go in more detail. Yes, for part mental health 101 part 2, because there's just so much to it. I think oftentimes, Angelina, when folks hear about mental health, they often think of other people. Then when you start talking about it, you realize, you know what, this impacts me also, and this is what I need to do. And I know you were going to get into some of that self care, and so maybe we'll have you back to talk about that as well, because we have to integrate self care in our daily and weekly practices, everybody of all ages. And so, any final closing thoughts you'd like to share?
Yes, when mental health issues impact one person in the house, it impacts the whole family. And so when we talk about interventions for optimal health, when we talk about self-care, well, even when we talk about the best practices to stay healthy and whole, see everyone as a collective, but also see everyone as an individual. Sometimes it can be hard as a caregiver to say, well, I'm not enough to take care of each. You're right. You're right. It's going to take a team. But it would have taken a team if you had one child or if you had 10.
Mm-hmm.
So incorporate people, and there's a framework that I use called the 40 developmental assets, and I'll include that in my list of community-based resources.
Mm-hmm. Okay. Thank you so much for that, Angelina. I have listed in the chat for those who would like a certificate of attendance to please add your name and email address in the chat, and we will get that certificate of attendance out to you, as well as this resource sheet that Miss Angelina is mentioning. We'd love to just provide whatever information we can to our community so that everyone has it and can share it and be aware of it as well. Like we have said multiple times here, we have to break the silence. We have to talk about it so that we can get better. I want to take this time as we come to a close here to just thank everybody who joined us today for this presentation. We are happy to have you join in with us in this collaborative effort between Family Roots for Life and NAMI Greater Houston. We have many more collaborative efforts that we're going to be launching here in the year, later on this year rather. And so look forward to seeing that information come out. And again, glad you were able to join us. Thank you all so much.
Thank you.
Thank you.
For what?
Thank you, Angelina. That was awesome.
Thank you. Thank you.
Take care, everyone.